What Courtney said was we started out with nothing. We started out in the back garage of a church with no resources, only what we had and what we willed to be able to offer people. And now we have this van and we will start from here. And now we can go out into these other 10 counties. And that to me is a very powerful reminder of just leading with an abundance mindset.
That was Barbara Wilgus, Program Administrator at the STD HIV Prevention Training Center at Johns Hopkins. Now, this episode is going to be slightly different. In this episode, we're going to focus on the external supports of Matthew 25, meaning the people and the organizations that do not work directly for Matthew 25, but work on behalf of Matthew 25 in supporting its mission. The STD HIV Prevention Training Center at Johns Hopkins is a member of a national network of prevention training centers funded by the U.S. Centers for Disease Control and Prevention, the CDC, to support health clinics and the health departments throughout the United States. In this episode, you'll hear from Barbara Wilgus, as well as from Christina Schumacher, two staff members from the Prevention Training Center at Johns Hopkins. I hope you enjoy the episode.
So my name's Barbara Wilgus. I am the program administrator for the STD HIV Prevention Training Center at Johns Hopkins. We are one of the regional training centers that's funded under the global national network of STI HIV clinical prevention training centers. And we are funded by the CDC to provide training and technical assistance to providers and programs who are looking to provide or expand their diagnosis, treatment, and management and prevention of sexually transmitted infections across a broad range. Our region is basically the states of Pennsylvania, and within Pennsylvania, the city of Philadelphia, Maryland and Baltimore City within Maryland, Delaware, Washington, D.C., Virginia, West Virginia, Kentucky, and Tennessee. And this particular grant cycle, we had a supplemental mission added to our usual work, which was to provide direct technical assistance, more intensive, high-level technical assistance to clinics and clinical programs that were awarded various grants from CDC to expand their sexual health services.
Okay, thank you. Yeah, you kind of answered some of the questions that I had, so thank you for that. I was wondering, in terms of thinking about the PTC, and thinking about the external but supportive role that the PTC plays as well as the CDC. What does that look like specifically for the PTC at Johns Hopkins when it comes to Matthew 25?
So when it comes to Matthew 25, which, so they were relatively newly awarded. So within the past, 3 years, were awarded a specific CDC grant, which I will not be able to remember what the letters all mean, but the SHIPS is the name of the acronym, which is specifically to programs to expand their sexual health services with a goal of also tying into ending the HIV epidemic in the United States. And what that looks like as far as our end from a PTC can be many different things. Sometimes it is helping a program with their figuring out their data infrastructure, like how to evaluate what testing they're doing and how to report it as they have to do to, for their grant requirements. Sometimes it is helping with workflows, looking at clinic infrastructure and seeing what ways clinic flow can happen more smoothly. Sometimes it's staff training, and sometimes it's just connecting one clinic to another clinical program. So it's kind of variable according to whatever they need.
Thank you for that. What were your impressions of Matthew 25 before your first clinical site visit? And since then, what are some of your thoughts after the site visit?
So when Matthew 25 was first awarded their grant, and we were assigned, I guess, for lack of a better word. So they were in our region, and so we were, asked to work with Matthew 25. My first thing is that I had not heard of this clinic, and so the first thing I did was the first thing I did was ask friends in Kentucky if they had ever heard of Matthew 25 and where they, if they lived around Henderson or Owensboro or Bowling Green. And then I went online to just kind of see what all they offered and what they were all about. So I kind of knew that it was a multi-site organization. And we had some early meetings and so met some staff. So that was all kind of before our site visit. After our site visit, I really just walked away so completely overwhelmed by how impressed I was, but by how much they do with what they have, and how all encompassing their services are, and how they put so much heart into everything they do. So our site visit that I'm referring to is we went down in late March of 2025 to do an initial site visit, kind of get the lay of the land as far as like their clinic proper. They did not, unfortunately, yet have their mobile unit in place, although we saw where the parking pad for it, like the RV parking for it, was going to go and things like that. So I do very much look forward to getting to go down and see that whole process in action.
And I know that you're from the South. You're from Tennessee, correct?
I am from Tennessee.
And so I'm wondering, as a Southerner, what are some of the feelings or thoughts that come up when it comes to witnessing Matthew 25's work, especially within the Southern cultural context?
So within the Southern context, and also really having a from growing up all across the state of Tennessee and traversing the state of Tennessee for much of my life before moving up here to Baltimore, really the rural healthcare aspect of things is what really is kind of what stands out more to me. So Western Kentucky is very rural and very much a agriculture, coal mining, steel processing. Those are kind of the trades of the land. And you're very far flung from, the next close town to get medical services that you need. And, we went to Henderson, Kentucky. There are 10 other counties that are going to be receiving services from this mobile unit. So even more places where people don't have regular access to this kind of specialized care that they may need. That's kind of, what I am very interested in helping out with is rural health, especially across the southern states where people don't have a lot of access to resources. Close by, that is.
And I know that you live a very multifaceted life. You have multiple interests and stuff. And thinking about the work or the impression that Matthew 25 has left on you, how do you like talk about Matthew 25 among friends or like holidays? Is Matthew 25 or the work that you do and the passion that you have for public health come up? And how do you describe the work that you do to people outside of the public health sector?
I specifically talking about Matthew 25, I always start with the most profound thing that had an impact on me, which was what the CEO Courtney Wilfork said when we were talking about kind of funding challenges across the public health landscape, but especially in rural health as well, and uncertainty about whether our program or their program could continue. And a thing that she said that had a profound impact on me in talking about, will this continue if you don't, if you, because the funding landscape is very uncertain, all of this funding could be taken away. And what Courtney said was, we started out with nothing. We started out in the back garage of a church with no resources, only what we had and what we willed to be able to offer people. And now we have this van, and we'll start from here. And now we can go out into these other 10 counties. And that to me is a very powerful reminder of just leading with an abundance mindset.
What are you looking forward to most with the continued partnership of the PTC and Matthew 25?
I am very much looking forward to being able to do another site visit and come down now that the van is there and operational. I want to go out with the mobile unit and see them in action, drive around for a couple of days and see how on the ground the ability to see people and test and provide treatment and all of the services that they have, that they work so hard to bring out to the people and the people to the services. And they're a wonderful group of people who care very deeply about the people around them in the state of Kentucky and Indiana. And so I very much look forward to coming back and seeing everyone again.
Were there any questions that I did not ask or any final remarks that you'd like to share?
I think that it is a rare and beautiful thing when you come across a program or a group of individuals that work so hard for the community that they serve and know the community that they serve so well and know how to bring everything that that community needs to them. And so it is very heartening when programs like Matthew 25 are able to expand their reach and reach even more people, because they have brought so much to so many people that don't have a lot in the state of Kentucky and Indiana. And so it is a beautiful thing to behold. And I think they should be just so proud of everything they've accomplished. And in just the short time that I've gotten to know everyone down there, I'm so blessed to have met them and get to work with them on a daily basis. And I look forward to continuing to do that in the future.
And now we'll hear from Christina Schumacher.
I'm with the Dr. Christina Schumacher. I guess getting started thinking about Matthew 25, how would you describe the puzzle piece that you hold in the picture of Matthew 25 providing that support?
The work that I do is looking at, evaluation and assisting and providing guidance and or technical assistance and guidance to these clinical staff so that they can better understand how their programs are working. So we have, sort of the general feelings about how things are going and the patients they see and whether or not we're helping. And we have policies in place about, and this is not specific to Matthew 25, but more broadly, and sort of the role that I would play with Matthew 25. We have clinics have policies in place about the types of discussions their providers should be having with clients and patients, or when and under what circumstances certain types of referrals are made and whatnot. And so my role is to use the data and the way things are documented in their medical records or in other systems, whether they be forms or makeshift databases and Access or Google Forms or whatever is going to work for them, to be able to take a critical look as to whether the programs are working and are implemented as intended, right? We're going to talk about HIV pre-exposure prophylaxis with everybody. Is that happen? Do we have documentation that that is happening, right? So, or we're going to give a gonorrhea, chlamydia, syphilis, and HIV test to patients who report sexual activity within the past 3 months. Is that happening? And nothing's ever going to be 100%. And so it's about, are they reaching the targets they set out? So when you start an HIV prep program, your goal within the first 3 months is never going to be to reach 100, to achieve 100% of anything, right? It's going to be incremental. So we're going to get, like, we want to reach 20% of patients, or we think that 20% of our patients would get the most benefit. And so that's who we want to reach. And so my job is to help them understand their data to evaluate those types of questions.
And thinking about like a thought exercise, like a before and after, what were your impressions of Matthew 25 before your clinical site visit and then after the clinical site visit?
To be fair, I don't think I had much in my mind in terms of expectations. We did have one meeting over, we had some conversations with them over Zoom or Teams in the interim. So one impression I had is that they did very much have good systems in place for data tracking, and they knew their systems. They maybe needed help figuring it out, but they had a good system in place and they had a good handle on how to use data, or at least it seemed. And that impression bore out after we visited. In terms of like the type of organization and their history and what their goals were and whatnot, I didn't have much knowledge about that. I was sort of like, oh, I think I maybe unfairly sort of assumed that they would need a fair amount of TA and guidance, just given that they were, rural and small and maybe not as experienced in collecting and processing data for these types of projects in the same way that an urban STI clinic that I tend to work with, where staff have been doing these kinds of projects for decades, right? And what I saw when we were there was a group of individuals who were extremely dedicated to their cause and the story of their founding, and just the message of hope and love for other people, like the humanity in it. And what's striking about that is that's something that I think is missing from our sort of collective American culture right now. And so it's heartening to see people like it doesn't matter. These are people who they are servicing, and I'm going to say we by meaning Matthews 25 as an organization. People in our community are suffering, and they need help and assistance. And Matthew 25 wanted that the group there and the group of people and the staff believe that this is a Christian-based organization, in their founding, at least, one of the tenets of Christianity is to help one another. You help someone who's in need, you help someone who's maybe a little bit downtrodden and having a hard time. We lift them up. That's our humanity. And I see that very much embodied in the enthusiasm of the staff and their mission statement, and just the way that they're just trying to look out for their community.
I've worked with you for like the last 5 years. I know that you have a family, you have a network of loved ones, and so I'm curious, when you're around family, whether it's the holidays or just visits, how do you describe the work that you do? And does Matthew 25 ever come up? Do you ever feel like sharing outside of a public health context the work that you do, and how do you describe it?
I'm working in the STI and HIV field for over 2 decades now, and I started my graduate work. And so my family kind of, there's not like the initial like questions and like, is that still a problem? And I didn't, that sort of has gone away. Like I don't need to describe that or talk about that anymore because they kind of just like, yeah, this is what I do. And I mean, they might ask questions about the state of things, or I'll get things in the like, one of my aunts or something, like she'll see something on CNN about like STIs rising and she'll send it to me and she's like, thought of you. Which, okay, it's kind of weird, but I did get questioned. I think we went, why are you going to Western Kentucky? I think there's if I use my family or others who I'm talking to and, like for work, I'm going to like even like Louisville and then now like rural Western Kentucky. Well, there's confusion about why we would be going all the way out into such a rural area because I think a lot of people associate STIs and HIV as an urban affliction. Um, and so that kind of is an opportunity to educate and when you bring up like kind of the opioid epidemic and sort of the issues that go along with that, it's kind of like, oh, okay, that makes sense now.
And I think that segues with my last question would be, what are you looking forward to most in that continued partnership of the CDC, Johns Hopkins PTC, and Matthew 25?
I'm excited to see how implementation of their outreach van um, is allowing them to, for lack of a better word, expand the reach of their services. So they had that beautiful space and they were, working within the community, but they were really looking forward to being able to meet people where they are with their outreach and being able to go more places and seeing if and how that has changed the level in terms of number of people, types of people, reach, and also if it's helped or if there's been any changes in their ability to deliver different types of services.
Well, thank you. Yeah. Any final thoughts?
Just I wish them the best of luck in getting these things off. I know because it is a challenging time right now. And so I mean even the little things that we can do, we should take heart in that. Like maybe we can't do everything right now or everything we want to do. But still knowing that we're reaching someone, I think is important. And I see that like for me, watching them, they're still reaching people. That's their goal and their enthusiasm and their dedication to that is, I think, should be inspiring to us all.